Good morning and welcome, everyone. My name is Gloria Miranda, and I'm honored to be your moderator for today's important conversation. Beyond words, empowering Latino communities by addressing disparities in palliative and hospice care. If you are joining us today, if you are a community health worker, a clinician, a student, maybe a caregiver, public health advocate, or someone that's simply passionate about health equity, we are so grateful to have you join us here today. We also want to give out a shout out to our partners, Ventanilla de Salud Network and Unidos US Network, for being part of this dialogue. For many Latino families, navigating through palliative and hospice care is not just about making medical decisions, it's about overcoming systematic disparities, including language barriers that significantly impact the quality of care. When its crucial health information, advanced care planning, and support services aren't available in Spanish or in culturally appropriate formats, families are left struggling, feeling unheard, underserved, and unsupported during life's most critical moments. Today's webinar will shine some light on those disparities and explore how we can bridge these gaps through education, advocacy, and systematic change. To help us get started with this webinar, we would like to invite and welcome Maria Otero, who is representing Compassionate Choices, which is our very generous partner and sponsor of today's event. Maria is instrumental in advancing health equity and dignity in end-of-life care, and we greatly value your support in Compassionate Choices. Maria, the floor is yours.
Thank you, Gloria. Good morning, everybody. Thank you so much for being here today. My name is Maria Otero, and I'm the Director of Priority Populations at Compassionate Choices, and it's truly an honor to welcome all of you to this important conversation or plática. At Compassionate Choices, our mission is to improve care, expand options, and empower everyone to chart their own end-of-life journey, guided by their values, their voice, and their vision of respect. But we know that for many of our Latino communities, the ideal is far from reality. Language barriers, cultural misunderstandings, and that deeply rooted inequities continue to shape how and if families receive the information and support they need during some of the most vulnerable moments of life. And now, in the current political climate, with a growing fear and the uncertainty brought by changes in administration, many of our people are scared. They're afraid to ask for help, afraid to speak up, afraid to be seen. These fears are real, and they impact the way people access care, how they trust institutions, and make critical decisions for themselves and their families. We are hosting this event in recognition of National Healthcare Decisions Day, which takes place April 16th, and it's a time to reflect on the importance of planning ahead and making sure that every person can do so in their language and in their terms. Today's webinar, Más allá de las palabras or beyond words, it's about naming those gaps and doing something about them, because we're not just talking about translation. We're talking about connection, about trust, about systems that recognize the diversity within our Latino communities and respond with care that is culturally grounded in community-led. At Compassionate Choices, we are committed to listening, learning from our communities we serve. Our Latino engagement work is rooted in collaboration, whether it's through local events, health events, community health workers trainings, education through the Ventanilla de Salud program, or other trusted partnerships. We're proud to co-host this webinar in partnership with the Latinx Voces and to be joined by incredible leaders in this space. I want to recognize the fearless Dr. Paulina Sosa-Quintanilla, who continues to be a fierce advocate for health equity in our Latino communities. Dr. Hernandez Torres, a member of our Latino Leadership Council, who worked alongside us on training and outreach efforts for the past few years. Carmen Martinez, Partnership Manager at Centro de los Derechos del Migrante, who brings a deep understanding of the language and labor justice issues that affect so many of our communities. We're also deeply engaged in national advocacy efforts to ensure that policy reflects the real lives of real people. That includes fighting for equitable access to palliative and hospice care, promoting advanced healthcare planning in Spanish, and elevating the voices of Latinos in end-of-life conversations that too often leave us out. This work is not possible without the leaders like the ones you're gonna hear from today, and without each of you who are joining us to make sure that we just don't translate words, but we transform systems. Thank you again for being here. Thank you for caring about equity, about respect, and about making sure that every family has the tools they need in their language and in their culture and in their communities. And gracias de corazón. Back to you, Gloria.
Thank you, Maria, for that wonderful warm welcome. And now we will move on to our presentation. And the very exact reason that it brings us here is beyond words. Many Latino families face challenges in accessing palliative and hospice care due to the language barriers and systematic disparities. This webinar will explore how the lack of culturally and linguistic appropriate resources impacts the decision-making for many Latino families and how we can improve the access and equity for Latino communities. One, we will highlight how the lack of linguistic and cultural appropriate healthcare services impacts the end-of-life care for Latinos. Two, we will discuss why language access is critical in ensuring comfort, understanding, and informed decision-making in palliative and hospice care. We will provide strategies for Spanish-speaking individuals and families that navigate healthcare systems and demand the language access that is very much needed. We will explore ways healthcare institutions can improve language equity and accessibility in palliative and hospice care. And we will discuss the role of advocacy in improving access to quality, culturally competent end-of-life care for all Latino communities. And now we will move on to our speakers. We have three wonderful speakers joining us today. We have Dr. Paulina Sosa-Quintanilla, who's Executive Director and President of Latinx Voces. We have Carmen Martinez, who's a Deputy Policy Director at Centro de Derechos de Migrantes. And we have Dr. Carlos Hernandez Torres joining us today on behalf of Compassion and Choice. We will begin with our first guest speaker. Dr. Paulina Sosa-Quintanilla is the founder, president, executive director of Latinx Voces. It is a national nonprofit with the goal to amplify all Latino voices and achieve equity in health and cultural representation. Paulina has worked for more than 15 years in public health, including policy, advocacy, data analytics, and community outreach. Her work has revolved around infectious disease transmission and pandemic preparedness, including influenza and COVID-19. Paulina has also completed her doctorate in the Dr. PH Public Health Informatics program at Johns Hopkins University, Bloomberg School of Public Health, with a research focus on data informatics, dashboard development, and health equity. Paulina has worked at the World Health Organization, WHO, and the Pan American Health Organization, PAHO, as a lead data analyst in the influenza team. She has worked with the American Journal of Public Health, AJPH, the American Public Health Association, APHA, and COVID-19 response team, and the Access Smithsonian's CIMI program in Espanol. Additionally, during the COVID-19 pandemic, Paulina provided consulting services for PAHO and other key partners in data, surveillance, and health communications. Please help me in welcoming Dr. Paulina Sosa with the next presentation. Paulina?
Thank you so much, Gloria. And it is such a pleasure to see so many of you all here with us today. I was just looking here at the chat. We have people from Washington, from San Antonio, from Connecticut. We have, so many amazing people here with us from Chicago. I would love to see where everyone is calling in from. So please share where you're calling in. As Gloria mentioned, my background has been focused on a number of different public health initiatives, but it is such an honor to come to you today in my current role as the President and Executive Director of Latinx Voces for this powerful webinar on language equity and data gaps. And so that's what I'm going to focus on today. And of course, I welcome any questions. I know we're going to have panel time after, but please feel free to share it in the chat. Just to start us off, I wanted to share a little bit about who the task force is. So our objective is to advance health equity. Yes, even in these uncertain times, that is absolutely our continuous goal, particularly within the Latino community, but within all communities as well. We empower Latino voices in health, foster strategic partnerships, and we advocate for culturally relevant policies through impactful community-based programs, such as with our amazing promotores that are on the call. And so first and foremost, I wanted to share just a little bit about our Luchad initiative, because the Luchad initiative is focused on health priorities in the Latino community. And this particular topic is absolutely one of those health priorities for many of the families and the communities that we serve, and for many of us personally, right? And so the Luchad initiative is focused on identifying health priorities, challenges, and solutions. And it is also an acronym. We love acronyms here at Latinx. It stands for Leading and Uniting Comunidades Through Health Awareness and Resources. And one of the biggest things that I want to share, we don't have time to get into the storytelling piece of the work that we do, but we basically have identified these health priorities from working with so many of you, community organizations, promotores on the ground, and hearing from you directly, hearing from families directly, what is important to you, what is important to your family. And so one of the biggest things that we focus on is data. And so that takes me to focus on the key community gaps that we see specifically in this field in palliative and hospice care, and really the lack of accessibility to our Latino families. And I would love to hear in the chat as well if this is something that you have faced, whether you're a promotore, community organization serving families, or even from a personal standpoint. So one of the biggest issues that we see across the board is this lack of language accessibility. And again, I don't know how many of us have had to serve as a translator, as an interpreter, to really help translate the resources and information in hospice, palliative care, really any healthcare service to the families we serve. I'm sure many of us have had to do this or had to fill this role, but it's really dire looking at the data. And so when you see 23% of hospice programs report offering services in Spanish, how many of us believe that? Because that is less than a quarter of our hospice services information that are translated in a language that serves a huge majority of our population. As many of us know, Latinos make up a majority of the population here in the United States. So this is showing a very clear disproportionate impact. So how can we fix this, right? How can we address this? Another very stark statistic I wanted to share was that Latino patients are less than half, less than 50% as likely to enroll in hospice compared to non-Hispanic whites. And again, that is not surprising, because we want to be able to access services that we understand, right? And I'm seeing here from Irene, it's hard to understand healthcare language for English speakers. Yes, absolutely. So it is definitely an issue for Spanish language community members. And actually, Irene, I think you touched on one of the biggest issues that we see across the board. It is hard to understand some of this healthcare lingo, period, right? And so how do we make sure that our Spanish information is also being translated not only in the language and the dialects that our communities and our families understand, but in a way that makes sense to us, right? And then last but not least is 1 in 3 Spanish-speaking Latino adults say they've had trouble understanding a healthcare provider due to language. I'd love to see in the chat if any of you have experienced that, either personally or professionally. I think this is a common issue that we see across the board, right? And so one of the things I'm going to talk about during my session is really how can we address this together as a community. I think, you know, as we're seeing here in the chat, we're seeing that language access matters in healthcare, period, but it absolutely matters when it comes to end-of-life care. So think of how hard it is to make a life-changing decision in a language you don't fully speak. And that's the daily reality for so many of our Latino families. And health is really about understanding and connection. Without that language access, many families must feel unprepared, overwhelmed, and misinformed. And we're here to fill that gap, right? And again, in the chat, if you have any specific issues or gaps that you've seen, especially with language access, I'd love to see that as well. One of the biggest barriers, as we've mentioned already, is the lack of interpreter access. We see that there's very many times a lack of interpreter services and definitely a lack of translated resources and materials. And many times this is due to the lack of funding, the lack of policy representation. But how can we make sure that there's a bridge to consistently and sustainably change this, right? We also know that there is a lack of diverse leadership in a lot of these spaces, especially around palliative and hospice care, to really address and represent the needs of the Latino community. And so few Latino or bilingual leaders are in these systems. How can we champion for there to be more representation of our community? And then last but definitely not least is the lack of policies in addressing language access barriers and gaps. And so I know another big issue that we see, and I'm sure this is something many of you have come across with the families that you work with, whether or not they're Latinos, right? I think this is kind of across all communities, but definitely in our Latino community, there's a stigma that comes when we talk about the word hospice care or palliative care. And so hospice means giving up. That is something we've heard many times. This is a common fear expressed in community conversations. And how can we break that stigma? How can we have a culturally grounded conversation with our trusted messengers, with our promotores, our community organizations, to have this conversation and it be more than just pamphlets, right? It's much more than just having a material piece of flyer or brochure that's in the Spanish language, but there's no conversation, there's no real breaking of that stigma. And again, there's a lot of fear around this topic. I'll be honest, I'm kind of nervous when it comes to this topic in my personal conversations. So this is a very real situation. It's a very real fear that a lot of our families face. So how can we tackle this together? And we know that communities are asking for clear early conversations in Spanish, right? And this is that first step to make this happen. Even more so and in line with the work that so many of you are already doing. We want to make sure that there's emotional and spiritual support, thinking about our church leaders, thinking about multi-sectoral stakeholders that are part of these conversations, and making sure that we're able to provide planning tools that reflect our cultural values, right? So it's more than just being heard. It's about listening and sitting with them and absolutely making them feel like their feelings are valid when it comes to this conversation. So just a last note for me is just thinking about how we can work together, partner together, and thinking about the change moving forward, and how can we, instead of doing outreach to communities, have action with communities, together with families, with promotores, with community organizations. How can we make sure that we're able to slowly start changing the way the system is into something that's more sustainable and accessible for our families? So that's a very quick run through my section, but I know that our next speakers are going to dive a little more in depth into the next pieces of palliative and hospice care and language access. So with that, I'm going to leave my email here. I know that my email's in the chat as well, and I'll go ahead and pass the floor back to Gloria. Thank you.
Thank you, Dr. Sosa. That was a very informative presentation. And without due time, I'm going to introduce Dr. Carlos Hernandez Torres. He is a dedicated bilingual physician with over 14 years of clinical experience specializing in family medicine, hospice palliative care, pain management, and addiction treatment. He earned his medical degree from Universidad Autónoma de Ciudad Juárez and completed his residency at the Southern New Mexico Family Medicine Residency Program, where he served as chief resident. Dr. Hernandez Torres also completed a fellowship in hospice and palliative medicine in New York Medical College. And throughout his career, he's practiced in diverse settings, from rural healthcare centers to renowned urban hospitals, bringing compassionate, culturally competent care to understand communities. Dr. Carlos Hernandez Torres, bienvenido. Adelante.
Muchas gracias. Buenas tardes, días, depending on your time zone. I know there's a lot of people here. I'm very glad to see that. Yeah, so my name is Carlos. I'm a family physician and I'm a trained palliative care physician. Based out of New York, but work in several parts of the country. First of all, I just want to thank Latinx Task Force and Compassion and Choices for having me in this important space once again. We've done very meaningful work together, especially with Compassion and Choices initially, helping out in Ventanillas de Salud and sort of providing some educational material. So thank you very much for having me here. I don't have much of a formal presentation. I feel that, hospice and palliative care is such a hot topic these days related to healthcare, especially after the COVID pandemic, that, you can find a lot of materials with very specific medical information on YouTube and a lot of other accessible resources. But I just wanted to sort of focus on what hospice and palliative care means to the Latino community and sort of how can we approach and improve our access language-wise and culturally to these communities. So I'm just going to run through a very fast definition of what palliative care is and hospice, because there's a lot of misconceptions about it, especially within the physician community, which is surprising. A lot of even myself, when I was just practicing primary care, I wasn't very familiar with what the difference was until or the intricacies of it until I started actually practicing it. So what is palliative care? Palliative care is defined essentially as specialized medical care that is aimed for people with serious illnesses. So palliative comes from the Latin verb palios or pallios, which means to cover or to cloak. That in context, that translated to, we're covering mostly symptoms. We're covering or cloaking suffering. So it's not really aimed to cure a specific disease. It's aimed at relieving suffering specifically. And suffering can come in very different forms. It could be emotional stress. It could be spiritual stress, which is also very important. So palliative care is essentially a team of people, which is usually composed of social workers and chaplains, and the provider or doctor is just a part of it. It's really just an entire team that focuses on this, and it can be, to clarify here, it can be delivered at any time of the disease, whether it be at the diagnosis of a serious illness, whether it be cancer, congestive heart failure, whatever it is, up until the very end. So hospice, from the American healthcare system points of view, is actually a benefit. It's modeled after the Medicare benefit of hospice care. It's not a place, because a lot of us confuse hospice with an actual place. So hospice is a service that provides palliative care in the last 6 months of life in any place that the patient wishes or is capable of. This could be at home, this could be at a hospital, at a nursing home, wherever it is. But the definitions themselves are not a big problem as they are. It's mostly how do we deliver those definitions, and how do we perceive as a Latino community, how do we perceive the definition of this kind of care. So for example, hospicio, or the word hospicio, and depending on where you're from, can mean a lot of things. It can mean an orphanage, it's what I grew up, thinking that it was an orphanage where kids grow up. It also has a connotation in some cultures of being a place where you're unwanted, where you go to die alone. Okay, so that's another definition that's going around. And that could be very scary when you first introduce it to patients. So when somebody is not doing very well, and the hospitalist or their primary care doctor, they bring up the word hospicio, sometimes immediately you get a reaction. Oh, no, I don't want. Yo no quiero que mi mamá muera sola en un hospicio, right? I don't want her to die alone somewhere. And it's not really what we're talking about, but this sort of highlights the importance of not only culturally sensitive delivery of care, but also language. And unfortunately, the healthcare system tends to clump the Latino community together, which is especially here in New York City. A lot of the promotoras and healthcare people watching here in New York, they understand what I'm saying. It's in New York City, we are Peruvians, we are Dominicans, Puerto Ricans, Mexicans, we are Northern Mexicans, Southern Mexicans, Central Mexicans, which the cultural context and the language also differs greatly when it comes to healthcare. So it's also extremely important to emphasize that culturally sensitive care doesn't just mean clumping a whole group of people together. It's the same thing with the Middle Eastern community, the Jewish community. It's just divided in so many different factions, right? So when somebody in the community actually gets it and delivers this kind of care, it makes a whole lot of a difference when it comes to making actual choices that have that may represent a very, very heavy burden to the family and the patient at the end of life. So I just want to, I'm probably a little bit overdue in time, but I just want to invite you to the Compassion and Choices webpage. There are a lot of materials and toolkits for patients and families in Spanish with regards to end-of-life care and sort of help guide you and your family to make these kinds of decisions. So passing the floor back to Gloria, but I will be available for any questions or concerns. We could go on this for hours and hours.
Thank you, Dr. Hernandez Torres. You are absolutely right. This is a very important, sensitive, and informative topic that really invites us to ask a lot of questions because it's something that really does affect us all. So we will come back and we will get to ask Dr. Hernandez some more questions. But for now, we want to move with our next speaker, which is Carmen Martinez. And Carmen Martinez is a dedicated community advocate with Centro de los Derechos del Migrante, CDM. Carmen is the partnerships manager where she manages external partnerships in advance to advance CDM's work. She graduated from Cornell University and holds a bachelor's degree from the School of Industrial Relations and has dedicated her career to advancing workers and civil rights, immigrant workers' rights. She's a proud daughter of immigrant parents herself from Jalisco, Mexico. Carmen, bienvenida y adelante.
Thank you so much, Gloria. So I will try to be as brief and concise as possible since I know we're running short on time. As Gloria mentioned, my name is Carmen Martinez. I work with Centro de los Derechos del Migrante, an organization, bilingual organization, multilingual organization, binational with offices in Mexico and here in the United States. Really what our mission is to partner with migrant workers to build worker power and advocate for fair labor migration policies. And so, I'll share a little bit about our organization, some about our legal framework, some about our language access work and our resources. One quick second here. Spring break here. So as I mentioned, our organization is a 501c3 with offices both here and Mexico, and we were really intentional in our founding about opening offices in Mexico because essentially our work is accompanying migrant workers to learn about and defend their rights as they move from their home communities to the United States to participate in agricultural and other seasonal work. And, I'll share a little bit about our language access work and the key reason why we engage in language access work, maybe a little bit more intentionally than we had in years past, really focused a lot and created a whole project around it, is because it is essentially a foundational right that whereby without it, we wouldn't be able to access any services, right? Or be able to defend our rights. So there's no practical way of, accessing health services at a local health department or, defending your rights at work, being able to, put in a complaint with a labor agency if you don't have access to that information in a language that you can understand. And so, again, briefly, there is a legal basis for requiring language access for entities that receive federal funds in the United States. Title VI of the Civil Rights Act, for example, prohibits discrimination on the basis of race, color, or national origin, including limited English proficiency. Also, Section 1557 of the Affordable Care Act reinforces language access requirements. And then some states and localities go above and beyond and have their own laws that strengthen language access rights for their communities. And one example is in Maryland. We have additional laws whereby entities that receive state funds, state funds need to provide language access. And when we, talk about language access, we mean providing people with limited English proficiency reasonable access to the same services as English speaker without any additional cost to the person with limited English proficiency, which is very key because essentially if there's a cost, there's going to be a barrier, another barrier that we're building into that. And then, language access can be in the form of oral interpretation. So having someone, orally interpret information that folks who are trying to access services, as well as written translation. So if there are vital documents that, for example, a patient needs to access the medical services, then we are looking at having a written translation of those documents for those communities. And for us, our project was funded by the Health and Human Services Office of Minority Health with a dual focus. We sought to continue to work with local health departments to develop and implement language access plans, including staff training. That was a huge focus of ours. And we also did direct outreach and partnered with other community-based organizations to do outreach to populations with limited English proficiency to inform them of their rights, of their language access rights. And with this project, we also really hope to, again, provide this assistance to local health departments, co-design and have some materials and resources for them to use in their own communications and outreach. to community members of limited English proficiency, but also have that be a replicable model so that other entities could also use it in their own efforts to increase language access for the people that they serve. And so just to share really briefly, some tools and resources that are available to you. As of this morning, lep.gov still exists, is still up, and it has a wealth of resources for folks who are looking to do language access planning, some materials that people can use to place in their physical spaces so that people know how to access language services. And other information on data as well. So a lot of really great information is available on that website. And also we encourage folks to visit their local and state health department websites to see and learn more about their language access plans and policies. And in particular for us at CDM, we provided language access training, as I mentioned. We have some customizable resources. Some of you who joined us at the Partner Spotlight in March saw and got to preview some of those videos where really the aim is to help people understand what language access is and how to provide or best practices in providing good language access. We also have information on community interpreter training programs, as well as language access planning assistance. And I know I flew through that, but if you have any questions about our work, you can feel free to reach out to me or to my colleague, Julia Coburn, and we'd be happy to answer those questions.
Thank you, Carmen. Very important topic as well. And I am sure that we are just have so many different types of questions because now we're going to be opening up for, I'm sorry, I'm checking to see if I'm unmuted. Okay, so thank you to all our speakers. We're now opening the floor for questions and reflections. We'd like to ask our audience if you can, type in a question into the chat box or raise your hand. We like to make this as integrative as possible. And if we don't hear from you right away, we do have a few questions to start off. So one of the things that we talked about was palliative care and hospice. We talked about the importance of data. We talked about the language barriers. So one of the questions is, actually it was one of the comments that I think is quite important that I'd like to address to Dr. Hernandez, is that, in the field of palliative care and hospice, sometimes there may be a lack of empathy that is expressed with the families. So how do you recommend that not only as a professional be able to express that empathy to families, but as a family as well be able to ensure that we receive that type of empathy? What do you recommend for those two areas?
Wow, that's a very good and very loaded question. Unfortunately, a bedside manner is not something that is trained in medical school or residency, and it's something that there's no class or there's no specific subject that says bedside manner. We have things like ethics and things like that, but it's not. It really relies on each provider, and I think from the family perspective, because we've been there as well, with my mom and other family members, is that if you feel that you're not getting the care that you need or the empathy that the case requires, then you are at your absolute right to request another provider or another team if they're available. I mean, sometimes in rural communities and other settings, it might be a little difficult where there's a shortage of physicians and such. But we in hospitals we typically routinely see people requesting second opinions or simply another another team or another provider specifically. Mostly, not that the provider is doing something bad, him or herself, but personalities vary within physicians as well. So that's one way to do it. But you raise a very important point that we do need more specific emphasis and training on this issue.
Thank you, Dr. Hernandez. And now we will move on and ask the question, because I mean, we can just, the questions are just endless. But what, and this is for Carmen, what unique challenges are migrant and immigrant families facing when it comes to palliative hospice care, and how does that, how can they better manage and be able to receive that care that is maybe lacking because of the lack of access in the language barrier?
Yeah, so I think speak generally to some of the challenges that we've seen, and some of the trends we've observed, particularly throughout the pandemic. And one of the major challenges that I'm sure everyone here is familiar with is the lack of health insurance, or economic resources to access those health services. And people might not be aware if there are low cost or free, resources. They may not be aware that there are. Some communities also, if they have limited English proficiency, might not know how to ask for language access at the doctor's office or at the health center, or the health entity might not have the language capacity or the protocols in place to serve that individual, to recognize that they need language services and serve that individual. Some communities don't trust health entities because they've been, exposed to a lot of misinformation, disinformation on the internet. And then some really practical barriers that we continue to see is, the lack of paid leave from their job to be able to make an appointment, go to the appointment, lack of transportation and lack of childcare continue to be some real practical barriers for folks as well.
Thank you, Carmen, for that. And the next one is for Dr. Sosa. Dr. Sosa, I know that Latinx Voces has worked very closely with community health workers and other healthcare professionals that work very closely with rural areas and communities, vulnerable families. In your work, what systematic issues do you see that is blocking Latino families from getting the care in their preferred language?
Definitely. That's a great question, Gloria. And kind of a loaded question too. I think you touched on, one of the critical partners in the work that we do, especially with our families, is the work we do with promotores and with community organizations on the ground. And some of you may have noticed that, I put where I'm based. I'm based here in Harlingen, Texas. So any 956ers in the call, shout out to you. But I think some of the critical systematic barriers outside of language access, I think, are also just the lack of funding. And I think a lot of individuals in here also mentioned that, but the lack of funding to promotore organizations and to community organizations that are doing this type of outreach work, I think, is another very critical gap that we're seeing. And that's part of why a lot of the work that we're focused on at Latinx is focused on sustainability and how can we together work on, real lasting change that can directly and sustainably continue to support our families and their needs. And so with more funding, we can increase the access to translation and interpretation services. We can hire individuals that are from the community to directly translate, the service of that clinic or of the work or the service that's being offered. And so I think that is absolutely one of the big barriers that we see. But of course, it all ties together, right? And I think that's one of the biggest issues that we see, why language access continues to be a huge issue for for Latino families. So that's kind of one piece. I know there's a lot of others that I can expand on, but I think that's probably one of the biggest ones that we still see today, even post-COVID pandemic.
Thank you, Dr. Sosa. And I want to go back to Dr. Hernandez Torres. You've been working with palliative care for so many years, and I believe that maybe your cultural background may have given you that, not just, the informational background that you need to understand Latino communities, but what could be an approach that we can use with diverse Latino communities, because not all of us are the same, without making any type of assumptions, especially when helping Latino families understand palliative care?
That's a very good question and a very good comment at the same time. Well, as I've been lucky enough, like I said, to work for a good part of my career in New York City, and that that has led me to make an effort to better understand different cultures. And I think, one of the most important things is providing materials for healthcare providers and healthcare personnel in general regarding cultural sensitivity. Um, and not only that, but the way, for example, the way that I approach my consultations when I was doing palliative care full time is through family meetings, and you engage in a conversation first with the family members and obviously the patient, the patients themselves, if they're able to speak, depending on the seriousness of their condition. And that's one of the ways I sort of gauge and measure what can I say and how can I approach this sort of thing. I've been lucky enough to work with a lot of great chaplains, for example. When people mention chaplains, they immediately think of a priest or somebody who's a religious person. But chaplains they're people that provide spiritual care, and they're very in tune with the cultural sensitivities of a particular person. So I approach them a lot, and I drag them over with me if I can to start those family meetings. So, because I have people that, they're not very religious, for example, and I drag one of the secular chaplains that I had in the hospital over there at Well Cornell, and that helped me sort of initially understand how can I approach this family, how can I approach this particular situation without just focusing on medical jargon and all these things. So that's that. Fortunately, we do have a lot of resources, but I think the most important thing is just to promote education as much as possible within medical schools and residency curriculums. But thank you for your question.
Thank you, Dr. Carlos. I'm going to bring in Maria. I believe Maria wanted to add something important. Maria.
Yes, Gloria, thank you. And I think, I just wanted to just say that the work that we do is so important. Working with community health workers, I think it's one of the key things to really reach out to our community, our Latino community, especially because they're trusted people from within their communities. And we need to understand that when we hear palliative care and hospice care, we usually hear those words when there's already like an emergency. We're at the hospital when our family members and we're not thinking correctly because we're like in high stress levels. So I think it's important that, part of like the work that we are trying to do is to try to not so much normalize it, but making sure that people understand. And like I said, this webinar is more about, it's beyond words. We hear what palliative care or a hospice care, we have an idea of what that means, but in reality, like we said, people don't understand what it is. So it's more than translation, more than the adaptation, but it's the literacy and the way we hear it. So for us, I think it's important to make sure that we do capacity building trainings to make sure that, when we hear about palliative care and we need to make those decisions for our family members or for ourselves, we understand what it is, so we're not scared about it, because I think we often are more scared about. Another thing is that we know our Latino communities are very respectful, and we're not going to ask questions. We're not going to be asking Dr. Carlos, maybe Dr. Carlos because he's a Latino man, but I can say that we're very respectful. We don't usually ask questions. So we need to be thinking about how can we empower our communities to really ask questions, and if I don't like the way they're treating me, or I don't understand what that means. So it's about connecting, looking at how can just present on what is palliative care. Is more understanding what it is. And oftentimes we know that, we hear, oh, what is palliative care? But sometimes we just don't want to go there just because we're fear of like making these decisions and things like that. But
Yes, and I think you have a really good point, Maria, because I think that also taps into, the misinformation, right? We hear it from the comadre, we hear it from the vecinos, we hear it from family members, and we don't really know what is true anymore. So it's so important, what Compassion Choice is doing, what Latinx is doing in getting this information out. And the other also is trust, uh, in the Latino culture. People are not going to ask you personal, sensitive questions without developing that trust level. So that's another thing that is quite important. And I think it's wonderful what everybody is doing here, because from Carmen to Dr. Hernandez and Dr. Sosa, and you, Maria, with Compassion Choices, is that everybody is actually doing work, which actually leads me to a question from one of our participants that is asking, because I think it's important to point out the times, the current times, and how is this going to affect our community, or how is it affecting our community now? So the comment that turns into a question is that there is, unfortunately, this impact is occurring at the moment, with this DEI services, and how, if any, has been the impact with the new changes to the minority serving organizations. So I want to point this one out to you, Carmen.
Yes, certainly a lot of the recent changes under this administration have had a lot of impacts on our organization, from funding to, I don't think, at least for us at CDM, it won't limit our services to the communities that we currently serve. If there were to be any limitations, any changes to grants that would impede, or that would, somehow want us to limit it, then I think we would, step back from that grant. But to this day, we as many other organizations are continuing to keep on top of like the changes that are coming down from the administration, trying to figure out how it's going to impact our communities, and trying to keep ourselves and them informed, make plans wherever possible. But it hasn't changed, our commitment to serve immigrant and migrant populations, and helping them defend their rights, and trying to improve the conditions, the policies in which they work in. But curious whether other folks have other thoughts.
Thank you, Carmen. Believe it or not, we are actually already getting to our hour. So what I'd like to do is, the conversation can go on, and that's why I'd like to invite our participants that we do have a second webinar to this series. So we'd like to, and we'll give you the details for April 23rd, but we will continue this conversation. I'd like to go ahead and ask Dr. Sosa, Dr. Hernandez, and Carmen for any last remarks that you have within a minute. Dr. Sosa, go ahead.
Sure. Well, a big thank you again to everyone for your questions and your comments. What I want to do is just invite you to keep this conversation going. My email is in the chat. And I just appreciate all the work that each of you are doing in your hospitals, your clinics, your organizations, your communities. We need more of these events. And so I am so excited for the next event we have in just 2 weeks. But please reach out to us. We'd love to see how we can collaborate with you and work together beyond this webinar. Thank you.
Thank you. Dr. Hernandez.
No, I mean, just to thank you all for allowing me to, provide some of my 2 cents. And just to remind everyone and invite everyone to understand that even by law and ethically, you are entitled to culturally sensitive and care and translating services. But as Maria and other panelists mentioned, as the Latino community sometimes is not very good at asking for their rights, but it's just something that we need to practice a little more. Every hospital by law and ethics is obligated to provide this for you.
Thank you, Dr. Hernandez. Carmen, any last remarks?
I just want to echo appreciation for being invited and participating in this very important conversation. I know it was focused on palliative care, but I think a lot of these concepts are applicable for care at large. So yeah, as Dr. Sosa has mentioned, I'm interested in continuing the conversation with you all, and feel free to reach out if you have any questions about the services we provide.
Thank you so much, Carmen. Maria, I'm going to give you 1 minute. You're muted.
Thank you. I think I was unmuted and then muted myself. But yeah, just saying that language is not just about being in Spanish, just to remember that it's about feeling heard, and it's about tone, emotion, context. And when people don't feel heard, they are not going to trust the system. And even when it has something important to offer, and we know that our Latino families care and they want the best for their families. And just because of the loss of translation or beyond words, I think it's where we miss the mark sometimes. Thank you.
Thank you, Maria, and to Compassionate Choices. We are going to continue this very impactful discussion, and we're going to do this within the next several months. So we ask you to stay tuned 2 more minutes with us so we can give you more details about all of these events that we have coming up. April 23rd is our next webinar. It's open for registration. Do so today. Don't miss out on this. And the next session is going to be Peace of Mind Starts with a Plan, financial planning for Latinos families. And we're going to have some expert speakers on future planning. Paul Zambi, who is a attorney manager who does a lot of power of attorneys, very informative and very detailed oriented. So we invite you to join us then. And Monica, who's also going to be talking to us about what are some of those laws that we need to be looking at. So very informative, register for that. And on behalf of Latinx Voices and Compassionate Choices, we want to say thank you. And once again, join us for May 14th. It's going to be a wonderful hybrid event that's going to happen. It is called Empower Everyone to Chart Their Own End-of-Life Journey Workshop. This is a hybrid event. So if you're in the Rio Grande Valley area, Harlingen, Brownsville, McAllen, go ahead and register for the in-person. If you're outside of the Valley and your only way to participate is virtually, go ahead and register as well. It is a free event. This is especially great for community health workers, promotoras, social workers, people in the public health field, that are working directly with families, or maybe you're just a family caregiver that wants some information. You are more than welcome to be part of this, and we are going to be giving you more details. Another thing is, if you are not part of our email list, put your email on the chat, and we'll include you on our email list so you can be getting all of this information, as we are working diligently with a lot of the nonprofit organizations that are doing work with Latino communities and vulnerable communities. And so if this is something that's of interest to you, jot down your email, send it to us, and we'll go ahead and include you on our email list. Also, save the date for a summit that's coming up, and we'll give you more details on that. For the moment, we also have the summer luncheon series that are coming up in the summer during the lunch hour. So the next one that comes up is June 25th. And again, we're going to be giving you more information on that through email, and if you visit our website at latinxvoces.org. So that brings us to a close. I'd like to thank you, and I invite you to fill out the survey that comes in at the end of the webinar. That is going to help us bring in more sessions, topics that are of interest to you. And that is really what is going to help us improve our programs as well. On behalf of Latinx Voices and Compassion and Choices, I want to extend a heartfelt thank you to all our speakers today, Dr. Paulina Sosa-Quintanilla, Dr. Carlos Hernandez Torres, and Carmen Martinez for your leadership, and to Compassion and Choices for sponsoring today's conversation. Thank you also to each of you who joined us today. We greatly appreciate your commitment to advancing culturally competent end-of-life care. Today is a wonderful day. Let's keep working together to ensure that all families, regardless of language and culture, or even background, receive the compassionate, dignified care that they deserve. Thank you again for being here. Gracias y bendiciones, y hasta pronto.